Hello, everybody, and welcome to the Managing Your Health, Exercising with a Chronic Condition webinar. My name's Michelle. I work for the Healthcare Consumers Association, and my role there is the chronic, I always get this wrong and call myself a chronic consumer, and then everybody laughs at me. Chronic Conditions Network Coordinator for the Healthcare Consumers Association. It's a big mouthful. And this is my colleague Darcy, who works in two teams, the health literacy team and also the infrastructure team. And so we are bringing you this webinar tonight as part of the Managing Your Health free webinar series that we run, which is on once a month. I am going to do the acknowledgement of country first. So we would like to acknowledge the traditional owners and custodians on the land on which we meet. We respect their continuing culture and contribution they make to the life of this city and this region. We pay our respects to their elders past and present. And we would also like to acknowledge other Aboriginal and Torres Strait Islander people who may be attending today's meeting. And remember, as we go through, you can ask any sort of question that you like. There's no such thing as a silly question. But the students will like to probably give sort of general advice on what we're talking about. So we're not going to be able to delve into people's individual diagnoses or exercise problems. And so it's more of a general chat on exercise and chronic conditions, but absolutely no such thing as a silly question. And even if it is a bit too specific, the students might have some idea of where you can get that information. So it's always good to ask. So the last thing I'm going to say is that we run these seminars to support people to understand their health, and we love to do them for free, and we love to get great subject matter experts because we are a health promotion and health advocacy organisation, and we've been operating in the Canberra region for 40 years to support the health system to improve. So this is one of our main games, and we love to bring you these presentations. And now I am going to introduce you to Caitlin Wazer, Ellie Godkin and Imogen McClelland, who are they're not all students actually. Caitlin is the student supervisor, and Ellie and Imogen are senior exercise physiology students. And so we're giving them this wonderful opportunity to work and develop their practitioner skills. So we're so lucky to have them and Caitlin along tonight. So I will hand you over to them to introduce themselves and start the presentation.
So my name is Imogen McClelland, and I'm beside Ellie Godkin. We're both exercise physiology and rehabilitation students at University of Canberra, and we're in our 4th year now. So we'll get started with the presentation. So it's physical activity in the prevention and management of chronic diseases. So all of our advice is going to be more generalised, but if you do have any specific questions, we can recommend that you go to your specialist exercise professional to get individualized advice. So what does an exercise physiologist do? So an accredited exercise physiologist, or an AEP, are health professionals with the knowledge and skills to design and deliver safe and effective exercise programs for people with short and long-term medical conditions, injuries or disabilities.
So this is just a list of the conditions we'll be going over today. So they're all pretty common. We've got hypertension, diabetes, coronary artery disease, chronic obstructive pulmonary disease, arthritis, and osteoporosis as well.
So we're going to be referring back to this scale throughout the presentation. So it's called an exercise intensity scale, where it's a scale of 1 to 10, with 1 being very light activity and 10 being maximal effort activity. So if we say something like we want you to exercise around a 4 to 6 out of 10, we're talking more about breathing heavily. You can hold a short conversation, but that's still somewhat comfortable, but you are becoming noticeably and more challenging.
Okay, so for our first condition, we have hypertension, which is high blood pressure. Blood pressure refers to the force that is being placed on the arteries from the blood flow. And this is just a table of the risk factors for hypertension. So things like family history of hypertension, having an older age, your gender, males are more likely to be diagnosed with hypertension, a diet high in salt, and also if you're overweight or obese. And then there's also just some factors that can cause fluctuations in your blood pressures, things like your emotional state, if you're feeling unwell, might have a fever, and exercise. They all tend to make changes in your blood pressure as well, but they're just not constant. This is our classifications for blood pressure. So the ideal numbers are 120 over 80. Hypotension, which is low blood pressure, is where your top number of your reading is below 100. And then hypertension, which is the high blood pressure, is where the blood pressure is 140 over 90 or above. So this is just some lifestyle modifications to help manage if you do have high blood pressure. Things like managing your weight to maintain a healthy body weight, reducing the amount of salt or sodium in your diet. If you can include some more fruits, vegetables, and low-fat dairy products, that's also pretty good. And to moderate your alcohol consumption, as well as increasing your physical activity levels as well. So what exercise is most beneficial for hypertension? So our aerobic system tends to be when we do our cardio-based exercises. So around 20 to 30 minutes, at least 3 days a week of this type of exercise will be beneficial, with an RPE, which is the scale Imogen was talking about, of a 3 to 6. So this should be pretty comfortable, but still challenging. Some examples include walking, running, even swimming, things like hydrotherapy or water aerobics. Cycling, you can even get some foot ergometers, which help with that as well. And even things like gardening as well can be really great for that sort of thing. And then we've got some strength training as well. So about 8 to 10 exercises for 2 or more days a week. Things like squatting into a chair, a bicep curl, or some push-ups as well. So why is exercise beneficial for high blood pressure? Mostly it helps to control, as it's an extra treatment alongside medication. Regular physical activity can cause a reduction in the blood pressure, which can then decrease the risk of heart conditions. And then weight loss can just cause a decrease in blood pressure as well.
So the next topic is going to be diabetes. So type 2 diabetics are unable to maintain a healthy level of sugar in their blood, and high blood sugar levels can lead to both short-term and long-term health effects. So when we want to monitor your blood sugar levels when you exercise. So you measure your blood sugar levels before and after exercise. You want to keep the safe range for exercise is over 4 millimoles and under 15 millimoles. It is important to make sure the blood sugar is in a normal range before and after exercise. So here's a table on hyper and hypoglycemia. So hyperglycemia means high blood sugar levels. So anything over 15 millimoles is high blood sugar. But if you have high blood sugar and you experience some symptoms of hyperglycemia, it's not recommended that you exercise until these levels decrease. Some of the symptoms of high blood sugar are excessive urination and thirst, headaches, weakness, and fatigue. So low blood sugar is also called hypoglycemia, and that's considered anything below 4 millimoles, which is too low and you need to increase it before you begin exercising. So some common symptoms of low blood sugar are lightheadedness, dizziness, sweating, confusion, and shaking. So if you do have a low reading of blood sugar, it's recommended that you take these 2 steps, technically 3. So you should consume 15 grams of fast-acting carbohydrates, like 6 to 7 jelly beans, or you can have half a can of soft drink or some fruit juice. And then once you do that, you want to recheck your blood sugar levels after 15 minutes. If they still haven't risen above 4 millimoles, you want to repeat step 1. Once you are back again above 4 millimoles, you want to eat a snack or a meal with long-acting carbohydrates, such as a slice of bread, a glass of milk, or some fruit. So exercise is really beneficial for type 2 diabetes. So for our aerobic exercise, we'd recommend 4 to 8 out of 10 on the RPE scale, which is like borderline uncomfortable, but you can still speak a sentence. 20 minutes a day, around 3 to 7 days a week. So you can be doing some walking, running, swimming, cycling, or gardening. And for some strength exercises, we recommend 8 to 10 exercises that target the legs, arm, and the core over a minimum of 2 days a week. So exercise is very beneficial for type 2 diabetes, as exercise aids in the management of daily blood sugar levels. Exercise improves muscle ability to use sugar in the body. Exercise can aid in weight loss effects, which can positively affect health. and it assists with the prevention and management of other diseases.
So coronary artery disease, also known as CAD for short, is our next condition. It reflects, so it's a major blood vessel that supply the heart with oxygen and nutrients, but the actual condition is where there's narrowing or a blockage of the arteries due to a buildup of fatty material, which we also like to call plaque, which can restrict blood flow to the heart. So there's just a little diagram there for some more understanding. So some things to know before exercising if you do have this condition. You should be able to define angina, which we'll get to in the next slide. Also be able to define the symptoms of angina. Define your own symptoms of angina, so this might be different for everyone. And also to describe immediate treatment and understand the appropriate upper limits of exercise as well. So what is angina? It's a type of chest discomfort that often presents as pain due to reduced blood flow of the heart. So when you're exercising, the heart requires more oxygen as it's pumping harder and faster to supply the muscles with blood to meet the demands of the body. Therefore, if there is restricted blood flow to the heart due to a blockage in the coronary arteries, it can cause these symptoms of angina like chest pain. Some common symptoms include discomfort in the chest, things like a pain, a squeezing, or feeling really heavy in the chest. Pain can be in the center of the chest and can radiate to other areas such as the neck, back, and arms, and the left side of the body is most common for those. Feeling short of breath, excessive sweating, and all of these symptoms tend to last for around 10 to 20 seconds. If you begin to feel any of these symptoms, you should cease exercise immediately and book an appointment with your GP. If the pain does not ease or pass after 30 minutes, it is considered a medical emergency and you do need to call 000 for immediate care.
This is the condition that often people confuse, like, am I having a heart attack or is it angina? Does anyone on the chat, on the presentation tonight, has anyone had experience with angina that they wanted to share? Because I know this is one that comes up quite a lot.
That's another question. So they've said, will there be any discussion of some actual exercises? So this presentation mostly just goes through the general conditions themselves, just because we think it's really important if you do experience any of these, that you book an initial consultation with someone like an exercise physiologist, just so that we can go over what you're currently experiencing, any symptoms you have. That's way we can make a targeted program for you dependent on your goals and what you want to improve. So it's really individualized for everyone. So not all exercises are going to be really beneficial for everyone. It's just different for everybody. So just continuing on that, what exercise is most beneficial for this condition? A combination of aerobic, so cardio and strength training is good. Around 4 to 7 days each week, beginning with 5 to 10 minutes, with a gradual increase of 1 to 5 minutes per session, with a general goal of 20 to 60 minutes for these sessions. So in terms of why it's beneficial in managing CAD, because CAD is an inflammatory disorder and exercise has an anti-inflammatory response, it can prevent further progressions of the disease. And also with improved heart fitness, the onset of symptoms of angina will be shortened and more activity to be completed as well.
So the next condition is COPD. So some of you might know that COPD stands for chronic obstructive pulmonary disease, which is an inflammatory disease characterized by airflow limitation in the lungs. So harmful gases such as cigarette smoke can cause an inflammatory response and leads to COPD. So some risk factors for developing COPD are smoking, occupational dust and chemicals, indoor and outdoor pollution, some environmental tobacco smoking like secondhand smoking, and infections. So the symptoms of COPD are ongoing cough or a cough that produces large amounts of mucus, which some people might know as a smoker's cough, shortness of breath, especially with physical activity, wheezing, chest tightness, muscle weakness, and becoming breathless with day-to-day activities. So again, for aerobic exercises, we're aiming for 3 to 4 times a week for around 20 to 30 minutes in duration per session. And for strength, And for strength, we're aiming at 2 to 3 times a week on alternate days with regular supervision to optimize physiological benefits and safety. So exercise benefits COPD as it decreases the symptoms such as breathlessness and fatigue, and can increase endurance, strength, and emotional function, and it improves your exercise tolerance.
So arthritis. Osteoarthritis is the most common form of arthritis in Australia, with more than 25% of people over the age of 65 having the condition related to joint and functional issues. For primary osteoarthritis, there's no identifiable cause and it is just normally genetic. And then secondary osteoarthritis is due to things like trauma, obesity, inactivity, and also, again, genetics, having some family history as well. So normal changes with aging include wearing down of the connective tissue in your joints, losing integrity of structures such as ligaments and tendons, reduced bone mineral density, and also in conjunction a loss of muscle mass. Osteoarthritis is not a normal part of aging, but it is a very common condition. Some signs and symptoms include pain in the joints, stiffness, swelling, decreased range of motion, and also instability and buckling, even when you're just walking. And then some long-term effects include inactivity, weight gain, further muscle mass loss, which then in return does increase the pain as well. So a combination of different types of exercises are beneficial for this condition. Things like Tai Chi, Pilates, balance, and coordination exercises also have benefits. So we want to aim for around 2 or more days per week for this type of exercise. In terms of cardio, things like walking, swimming, cycling, and hydrotherapy are really beneficial. And then strength exercises as well, things like lifting weights, resistance bands, or even using your body weight. How does exercise benefit this condition? It overall improves mobility, function, stability, and support. It strengthens the muscles around the joint, and then regular physical activity can help in prevention or management of other chronic conditions such as diabetes or osteoporosis.
So following on from osteoarthritis, we've got osteoporosis or osteopenia. So osteoporosis is a loss of bone mineral density, which affects the strength and integrity of the bone to withstand loads and forces. It's very common and occurs in 1 in 3 women and 1 in 8 men. So the primary causes are age-related and often seen in postmenopausal women, but there are some secondary causes such as poor nutrition, physical inactivity, late or disrupted menstruation, certain medications, and hormonal disorders. So if you did want to check that if you have osteoporosis or osteopenia, you get a DEXA scan, which measures the amount of minerals and calcium in the bones. So the results are called a T-score, and based on the score, it will indicate your bone density. So if your T-score is less than 1, but more than less than 2.5, it's osteopenia. But if it's less than 2.5, it's osteoporosis. So exercise can benefit osteoporosis as you're loading the bone through activity with impact and strength training, which then increases the bone mineral density. It slows down and prevents further loss of bone mineral density. And there's evidence that shows a good connection between regular exercise and reducing falls risk. For the best exercise for osteoporosis is strength training 3 to 4 times a week, which both strength training focusing on whole body strength, posture, gait, and functional stuff like climbing stairs. But you can also do some specific balance training, such as challenging your balance on unstable surfaces with your eyes closed and dynamic balance, so like moving over objects and stuff. There are some red flags for osteoporosis though, so high impact or explosive loading of your limbs like running or jumping, and loaded spinal bending or rotation aren't very good for osteoporosis, but the benefits outweigh the risks of exercise.
So DOMS might have been a term that someone has heard of before, stands for delayed onset of muscle soreness. It presents as a sore, aching feeling in the muscles following unfamiliar or unaccustomed bouts of exercise. So maybe if you first done your first session and you start to feel a bit sore, it might just be because of DOMS. It generally gets better on its own after a few days to a week, and it is a normal experience after you exercise. So in relation to DOMS, but also just generally, stretching is very important. It's beneficial following exercise as muscles are warm and can reduce the effects of DOMS. Other benefits include decreasing risk of injury and also enhancing the ability to perform day-to-day activities.
So adherence is a big thing when it comes to exercise, and we've got some tips on how to maintain a good exercise routine. So doing great group programs so you can exercise with your friends and you can help keep each other accountable, setting small goals that are realistic and achievable to yourself, and also keeping a diary which can track the process of a home program or an exercise program. So we've got an example on the screen. You just write down what you did, how long it took you, and anything else you might write over across a week.
And then we've also just got some general tips for managing chronic conditions, just generally. First of all, I'd say most importantly, find out what works best for you. Some people tend to really like the group classes because they're able to socialize as well, meet new people. That's a big thing for them. Other people tend to just like doing things on their own. So enjoy having a home program, things that they can just do by themselves at home. And then some other people like having one-on-one sessions just so they can make sure they're having the right technique and they can make relevant progressions alongside an EP if necessary. I would also say to optimize your good days without overdoing it. So if you wake up and you're feeling really good, make sure you go and do some exercise, but make sure you just don't overdo it and could make things worse. Also follow an individualized program prescribed for you with the guidance of an EP. So as I was saying earlier, all conditions are going to be different for everyone. Everyone's going to have different goals. And that's why we're here to make sure that we prescribe safe exercise for you so that we can stay aligned with your goals and also your recovery as well. Also do activities that are fun to you so that you stay motivated. So we've got a picture of people playing golf here. This tends to be a big one that we see. Anything like that, getting out of the house, moving your body is always going to be good for it. Have regular check-ins with health professionals as required. So make sure you see your GPs regularly, any surgeons you need to see, things like that. And also a big one is following your prescribed medications regime and management plan. So a lot of the time we may get some people in the clinic but they haven't been following their medications and maybe they have a potentially high blood pressure. But just for safety reasons, we're not allowed to exercise them. So make sure you're staying on top of your medications and also your management plan if you've got one of those. And then this is just some information for us here at the Student-Led Exercise Physiology Clinic. It is a low-cost exercise clinic run by exercise science and exercise physiology and rehab students of UC. It is $10 for a group session. I believe it's $50 for an initial consult and $30 for a one-on-one, roughly. We're located on the UC campus, Building 28, and we do take appointments via phone or via email. So make sure you can give us a call if you want to book an appointment. We're open Monday to Friday, 9 until 5 p.m.
Thank you for listening.
Thanks, guys. That was a lot of information quite quickly. So we should have plenty of time for questions. I just wondered, since we do have a little bit of time, can you run us through what it might be like to attend your first exercise physiology session? So say you'd gone to the GP and they'd say, we recommend that you go see an exercise physiologist, and the person's never been before. They have, let's be non-specific and say they just have some general health concerns and conditions. How would they approach their first appointment, and what would it be like? What sorts of things would you run them through and talk about?
So you start off with an initial consult where you spend about half an hour taking some health history questions. So we just get a bit more information so we can individualize a program for you. And then you do a couple of assessments so we can get a baseline of how you are, and we can then reassess and we can see about how much you've improved later on. But then you'd have an individualized program written by an EP, and that can be a bunch of exercises that they believe that you'll enjoy, are going to help and reach the goals that you want to reach. And then, you just come through, do your exercise program.
So you'd be coming so like whatever, depending on what your plan was, you might come back monthly or weekly, or like, does it really just depend on the situation, or do you sort of engage with it for 3 months and then see how you go on your own and then come back for a bit, or is it just one of those things where it really depends?
So at the SLEP clinic, we've got, we kind of aim for 10 weeks, a 10-week program. So you can come in once or twice a week, whatever works best for you. But we aim for 10 weeks and try to really set you up nicely so that you can be referred on to a different EP clinic or a different gym or whatever works for you. But yeah, we aim for 10 weeks here.
Okay, that's awesome. Darcy has collated some really good questions from our sort of when people registered. So I will pass over to Darcy to ask a few questions, and then there's some in the chat as well.
Yeah, and I'll just encourage anyone to jump in if you do have some questions. But we do have 2 in the chat, so I might jump into those first as well. So we've just got what is the cost then if you come back a week later? So is it sort of a standard cost for each appointment?
Yeah, so we tend to start people off with a one-on-one session just so that we can go through their program, make sure they know what they're doing, got the right technique, make sure they're safe, all those sorts of things. And then on from there, for the next 9 or so sessions, we tend to encourage group classes if we think it would be safe for you to be in one of those, and they're just $10 per session. So it doesn't matter if you come back twice a week, they're $10 each, or if you have a break in between, it's just $10 per session. I believe you can pay upfront though, $100 for the 10 sessions, or you can just choose to pay $10 after each session. We just give you a payment slip at the end of your session.
Thank you. And our other question is in the chat is, would you be able to tell us a little bit about the GLAD program?
I can talk about the GLAD program briefly. So the GLAD program is something that is run by a lot of physiotherapists. There's plenty of clinics that run these programs within the ACT and surrounding areas. It is a program that is specifically designed for people with osteoarthritis, but making sure that they have the appropriate training. So the GLAD program is a specialist program that people do train for. So our students don't fall into that category. We don't do that training here or provide that program as part of our service. However, mostly it is physiotherapy clinics that I am aware of that offer the GLAD program.
Thanks, Caitlin.
What does GLAD stand for? Sorry, just now I can see GLAD in capital letters, and now I need to know.
No, now you're really going to test my knowledge there, because I've always just referred to it as the GLAD program.
We can come back to that
later.
Yeah. And we have, is the room set up like a gym? And then I'll jump into our pre-questions that were in the Eventbrite.
Yeah, so the main room, we actually call it the gym. It is, yes, set up like a gym. We conduct initial consults. We're actually in the process of getting or building an initial consult room. Currently, we do initial consults in the gym as well. But yes, it is set up like a gym. We've got some machine-based exercises. We've got some cable machines. We've got some bars that people like to do balance exercises on. We've also got some free weights, some cycling, some ergometers, and then an area for us to measure blood pressure and heart rate and that sorts of things. We've got TheraBands as well. A lot of them are just body weighted exercises too. So we can do lots of stuff here in our gym. We are located on the top floor, so that's where our gym is. And then how long do each of those weekly sessions take? So the group sessions are an hour long, and the one-on-one sessions go for 45 minutes.
Perfect, thank you. So I'll just jump into these questions. So the first one we have is, do you sort of have any tips on how to manage the day-to-day unknowns of chronic illness? So when these conditions that you've talked about pop up. So this person's kind of given an example of one day maybe feeling great and the next day not feeling great. Do you sort of have any tips around navigating that?
I'd say sort of like we talked about on the last slide, we understand that you're going to have some good days and some bad days. I would just say my main point would be taking advantage of when you do feel okay. Also, we're not going to hold it against you, or you shouldn't feel guilty if you feel like you do need to cancel a session just because you're not feeling up to it. That's completely fine. So yeah, I'd just say go the best you can, and take advantage of those good days. Make sure that you don't overdo it just because you're feeling better one day opposed to the other. It could actually, you could feel worse the next day. So just in moderation, make sure you stay on top of that. I don't know if Imogen or Caitlin have anything else.
One of the other things that we do as an exercise physiologist is working to identify your tolerance levels of exercise, and different chronic conditions, depending on whatever they may be, respond differently, just like different individuals do. So some people might have a really low tolerance for a small amount of exercise, and what we do is just identify that that's where we need to target our exercise for that time period, and then try and build up from that. So starting small, it could be in terms of duration, it could be in terms of intensity or resistance, or it could just be that you do it once a week rather than doing it 3 to 4 times a week. So it's about doing it in moderation and learning and responding to how the body responds to that level of exercise too. It's really important that you listen to the body as well, but then identifying what you can push through as an expected outcome from exercise, or what we don't really want to see as an expected outcome of exercise as well. So making sure that we are tolerating exercise in the appropriate way too.
Yeah, thank you. And this leads into another one of the questions that we have here. So is it okay to continue exercise during a flare-up?
Yeah.
I'll answer that one as well, because it is quite complex. Again, considering that we are talking about multiple chronic conditions across the board here. So generally speaking, yes. However, it depends on what that flare-up is and what the outcomes are for that individual. So exercising should be something that, say it's due to fatigue, that you have an increased level of fatigue, and that's what you're identifying as the flare-up. Then exercising is something that we know to improve fatigue. But again, making sure that we don't push you over that boundary. We want to make sure that we're contributing to making you feel better, rather than doing so much exercise that then that increases the intensity of the fatigue that you're experiencing. Also, having said that, say you have an inflammatory condition and you decide to push through some of the flare-up that you're experiencing with that, that may not be the best option at that point in time as well, because the body is going to continue to send out the inflammatory signals to you, and it's just going to make you feel worse at that point. So you could continue to exercise, but it's really important to do it under the guidance of someone that understands the flare-ups, if you don't have that understanding yourself of what the flare-up may mean to you.
Thank you. Did we have any other questions?
I saw there was one on the chat. It says, are the group sessions on the same day or time each week? So group sessions run, I believe, Monday, Wednesday and Friday. And then we do the initial consults and the one-on-ones on the Tuesdays and Thursdays. In terms of the time, I think they're 2 of the days are the same and one day is different.
Just slightly, yeah. So all of our morning sessions are from 10, there's a class at 10 a.m. on Monday, Wednesday, Friday, and a class at 11:15 a.m. on Monday, Wednesday, Friday as well. And then on Monday and Fridays, we have classes from 1:45, and then on Wednesday, it's from 2 p.m. The other thing that's really important to note about our group classes, and what it may be different to if you go to a group class, say in a regular or a commercial gym setting, is that you are completing the program that has been designed for you. It is not a follow the leader style class. It is, you are supervised by myself as the educator, and also our students, just with other people also working along and doing their own program at the same time.
And then the cost for those one-on-one sessions, 40.
Yeah, so it's $40 for a one-on-one session. We do have concession prices, which again are slightly discounted. I will say that in comparison to a private clinic, it is significantly discounted as we are a student-led clinic. So if that is a service that you want to go through privately, that's okay. You just need to be aware that it could increase your cost.
And then how many people do you have in a group class? We have a maximum of 10 people in each group class.
Is there what's the referral process to go? It's like, do you need a referral from a GP or a chronic conditions plan or anything like that? Or is it just a self-referral? Sorry?
No.
No, you can just ring up.
Looks like you're muted.
Oh, I'm muted.
No.
I don't know if we're the only ones.
Darcy, can you hear me?
Yeah, I can. Michelle was just asking about the referral process.
Oh, yes, we're getting some sort of a fun echo. What have I done to have I done something to my?
Oh, good.
Oh, are we fixed?
So do not me. Sorry, we're back.
Can you hear us?
Okay.
Great.
You can hear us. I just want to say, is there like a referral process for your clinic, or can people just self-refer? Like, how do people normally come to you?
It can be either. A lot of the time we actually get referred on because there's other student clinics here. We've got nutrition and dietetics. We've got a physio clinic as well, and a psychology clinic here, and speech pathology, optometry, and OT as well. So sometimes they can be referred from the clinics here. Other times we just get normal GP referrals, and you can just call up to make an appointment as well. So you don't have to be referred. That's just why we do the initial consults, just so we can grab all the information we need.
Yeah, so there's like no eligibility criteria. It's just you come along and you do your one-on-one sort of initial consult and see where you go from there.
Yeah, part of your initial consult with the students does allow them to give you a clearance for exercise. And if we do require a clearance from your GP, we would send you back to your GP to get that clearance before coming into exercise. That does happen sometimes, but again, we're just making sure that we're ensuring the safety of everyone, and every practitioner that's involved in your treatment is in agreement that we're working towards a common goal.
Perfect. That sounds good. Anything else from you, Darcy?
Sorry, Emma, did you have a question? Putting you on the spot now. I can jump in. I think we had one final question that we'd collected. So someone was asking, when you're starting a new exercise, how do you identify sort of what's just pain from starting that exercise and maybe using muscles that you haven't used before? And is there, kind of good pain and bad pain, and how do you identify that?
I can answer that one as well. So generally, when you are exercising, we don't want you to be doing an exercise which would make you want to stop immediately from doing that. So you should be reasonably comfortable and able to push yourself where it is difficult or hard, but not painful. Having said that, then we talk about the recovery process after your exercise session. And that's what both Ellie and Imogen spoke about in terms of DOMS. We would expect DOMS to last for up to 2 to 3 days. And generally, most people would have experienced this in some point in time in their life, regardless of whether they have been physically involved in exercise specifically, or just from having a laborious day in the garden or something like that where the body is stiff. So, you can still do your day-to-day tasks, but it does feel like sort of a general aching and stiffness. If that gets to last a bit longer, more so up to a week or longer than that, then that's not really a response to exercise that we're happy to see. We do consider a 2 to 3 day recovery period with some general stiffness and aching to be a normal part of your exercise recovery. But yeah, that's probably the best indication as to know if something is a good type of stiffness and soreness, that you have worked hard enough, that we're altering the body and making those physiological changes, or if maybe something's been pushed a little bit too far and therefore causing some further injury to the body, which we ideally don't want to do at all.
Thank you. Did anyone have any more questions they wanted to jump in with? We do have one in the chat about can assessments be done via telehealth, or is this maybe something that other clinics could do as well?
Yeah, we don't do telehealth consults ourselves in our clinic anymore. Definitely there are private clinics that do telehealth consults. There's also some practitioners that may do home visits and come and do a consult at your home, or come and go through your whole program with you in a home setting. However, all of ours is face-to-face within the clinic.
And then there was just one question. Colleen said she couldn't hear our answer. So just to go back to reminding her the cost for the one-on-one, that's $40. And then how many people do you have in a group class? It's 10 people in a group class with 4 student EPs.
Awesome. Yep, I think she's nodding. Yep, good. Cool. Okay. Is there anything else? I think we're coming to the end of the questions now, but we still have a little bit of time if anyone's been sitting on a question and they're not sure. No, looking pretty good. Okie dokie. Well, thank you so much, guys, for giving us all that information. That was really detailed, and I really enjoyed that Q&A at the end, because I think that gave some people some really good idea around how exercise physiology can work and how you can get a program tailored just for you and your condition. So I think that's really useful information. As always, we still encourage people to talk to their GP and make sure, and I mean, Caitlin very clearly said as well that they really like to work in a team with your GPs and your other medical practitioners. So good to keep everybody in the loop and not go and try anything too new too quickly as a result of coming to one of our talks. So what we will do from here is we have a bit of a link in the chat to an evaluation form. So we are an organisation that likes to constantly improve on the services that we can offer to the community. So if anyone wants to click on the link and fill out like a little, I think it's only about 4 questions evaluation of tonight's presentation, we would really be grateful, because that always gives us insight into how we can make little modifications and make things a bit more different for next time, or keep it all the same if it's perfect. So Darcy's posted that one in now. I think that's pretty much all the information. What I will do in the coming days, maybe tomorrow or Monday, is send out an email with a link to the survey as well, if you don't get it from the chat, and also some links to the student-led clinic website, the UC website, and a link to this recording so you can go back through and listen to anything, and possibly a summary of the slides from the presentation as well. So just in case any of it was unclear, or we went through something a little bit quickly, or you just forgot and wanted to remind yourself, I will send you all the links and all the information that you will need to access anything we've talked about tonight. Is that everything, Darcy? Have I missed any glaringly obvious bits of information that I'm supposed to tell people?
Yeah, just a big thank you to Caitlin, Imogen and Ellie for coming along and jumping in that conference room late tonight.
Yeah,
really appreciate it. Thank you.
And you did a great job. We're super, super grateful to have you. Okay, I think if everyone's ready to skip back to their dinner or their evening activities, we can probably wrap up.